In the United Kingdom, hospitalization rates have been rising as the new concerning Omicron variant of the COVID-19 sparked a wave of new infections. Health officials in England have warned that number of new cases would break records in the next few weeks. Many health experts here in the United States are now fearing that this new trajectory of cases from Omicron will be seen here in the next coming weeks. Today, the CDC reported that new infections caused by the Omicron variant has increased sharply and could cause another wave in the next coming weeks. Regions such as here in New Jersey, New York, Puerto Rico, and U.S. Virgin Islands, Omicron infections have already reached 13%. This is happening while the Delta variant is still causing more number of cases, making a strong case for all to get vaccinated in the nation. Remember, you protect yourself and others by getting the COVID-19 vaccine. It's a service to the people of this country. So again, you can visit vaccines.gov for more information. On this and much more, we spoke with Dr. Deena Adimoolam. Here is Dr. Adimoolam about the cases and deaths in the nation right now. We're looking at more than 800,000 deaths in the nation with at least 50 million cases. My question to you is, why is this happening and what are you observing while you are treating patients?
So we do believe that this surge is expected after having had Thanksgiving together with many families coming together in certain areas. And we are also seeing a rise in areas as we had expected, where we have a lot of unvaccinated populations.
Right. And then let's now talk about what is also causing the surge of cases, the news that is coming in today. We're hearing that the new variant, the Omicron variant of the coronavirus, is causing and doubling the number of cases every 2 days. How are you looking at Omicron's arrival into the United States, and what is it going to do to the cases and numbers of deaths?
So as you know, currently in the United States, Delta variant is still the specific variant that's causing the most number of hospitalizations and cases. So this is still a pandemic of the Delta variant being the predominant strain. We know that Omicron has made its exposure here in the United States, but we haven't really seen that significant number of cases yet. We know that it may potentially rise as we look at data that is coming out of South Africa, where the Omicron variant is the predominant strain, and there's an increase in the number of cases related to that variant. But we just don't have enough information yet to know how Omicron is going to affect our US population here.
The EU is saying that Omicron will become a dominant variant in the next coming months. In the UK, it's already getting to that level. So is it just time, doctor, before we see the same trend or trajectory of cases here with Omicron?
So I think only time is going to tell, Aditi. We really don't know. We can't really compare ourselves to other populations. So we're going to have to see what exactly happens in the United States. If you look at the vaccination rates in areas like South Africa compared to the United States, the vaccine rates in South Africa are 20 to 30%, which is much less than what they are here. So it's important to sort of keep that in mind when we're looking at the populations and the trajectories that we are alluding to in other countries. However, if the Omicron variant becomes as significant as it is in countries like the UK, similar to what we might expect in other areas in Europe where they have similar vaccination rates in the United States, it's going to be very important to make sure that we're doing everything to be cautionary in terms of protecting ourselves against this.
Right now, when looking at this country, what areas are you most concerned about as we go into the months of winter?
So we have a lot of data coming out of certain states like Michigan, for example, where there's been a lot of recent hospitalizations. Hospitals are talking about how they are understaffed, some of them, how they're concerned about bed shortages. So some of the situations similar to what we were seeing last year at this time in different areas around the country are being seen in places like Michigan. And talking to colleagues there, people are also concerned about, what this means for people who are coming into the hospital for other reasons, like a motor vehicle accident or for a heart attack, for example. So it's very important to look at those populations, to do the best that you can if you're living in those states where there's a lot of people getting infected with COVID right now, and do everything that you can to be safe. So the main places I'm concerned about at this moment, just looking at the data this morning, is Michigan, Indiana, and Ohio. And of course, I'm still concerned about the areas where vaccination rates are less than 55% in the country, as well as becoming potential hotspots, especially after the holiday get-togethers.
Let's talk about the vaccine, doctor, a little bit. We are trying to push vaccinations across the country. The Biden administration is doing the same thing. There's also a push for booster doses to get more booster doses into the arms of Americans. Now, if you look at it in a strategic manner, what needs to be the focus right now? What will get us through this pandemic a little bit better? Is it focusing on the booster or getting more of the first doses into the arms of Americans?
So I think it's important to remember that you'll only qualify for a booster after you've received the initial vaccination. So I think that the focus should be on getting as many individuals vaccinated as possible. People who are above the age of 5 years and older, unless there's a contraindication, can all qualify for getting a COVID-19 vaccine. We have a lot of data to suggest that it's safe and effective. And we also know that the booster is extremely important at this time as well. It improves your ability to fight off COVID-19 infection. It improves your antibodies significantly, sometimes up to 40 times more antibodies after receiving the booster vaccination. So if you're 16 to 17 years old and you've gotten the Pfizer vaccination in the past, then you can maybe qualify for the Pfizer booster vaccine. And if you're 18 and over, you can qualify for any of the booster vaccinations. So please consider getting boosted and vaccinated.